Hi everyone, my name is Florence Okewali and I'm here to talk on my PowerPoint presentation titled Diagnosis Based on Clinical Tests. I have a patient here named Mr. John. He weighs 200 pounds and is a Caucasian male who just turned 45 and complains to his physician of a swelling in his abdomen and puffiness in his face and legs. Recently, he noticed he bruises easily. He is 6 feet 2 inches with a blood pressure of 135/75 and 50% hematocrit. His appearance is important to his career in show business, and he mentioned a custody battle with his ex-wife is causing some additional stress. Some clinical tests was performed on Mr. John. The tests include glucose meters test, that is the blood glucose test, Benedict reagent test, that's the urine glucose test, and reagent strip test, that's the urine glucose test. The glucose meter test measures glucose concentration in the blood, providing immediate information about the patient's blood sugar level, which is essential for managing diabetes. Benedict reagent test detects reducing sugars, such as glucose in the urine, and it's used to screen for glycosuria, which indicates diabetes or renal glycosuria. The reagent strip test quantitatively measures glucose concentration in the urine and helps to diagnose diabetes, monitors glucose level, and assess kidney functions. Based on the clinical test results and symptoms, Mr. John shows indication of pre-diabetes or diabetes mellitus, potential kidney dysfunction, and possibly Cushing's syndrome. The proposed treatment plan includes lifestyle modification, that is dietary changes, exercising, stress management, medical management, which includes diabetes treatment, kidney function monitoring, and evaluation of Cushing's syndrome. Regular follow-up with endocrinologists, nephrologists, and routine blood tests are recommended to address this condition and improve Mr. John's health. So 3 tests was performed on Mr. John, which includes glucose meter test, that is the blood glucose test, Benedict reagent test, that is the urine glucose test, reagent strip test, that is the urine glucose test. The glucose meter test was carried out by drawing Mr. John's blood. Then a drop of his blood is placed on a designated area on a test strip. The test strip is often inserted into the glucose meter. The glucose meter reads and displays the blood glucose level, which is 105 milligrams. What that tells us, the test measures the concentration of glucose in the blood, and it provides immediate information about the patient glucose sugar level, which is useful for diagnosing diabetes or monitoring glucose level in diabetes patients. The Benedict reagent test, that is the urine glucose test. A portion of the urine sample of Mr. John was collected and it was mixed with the Benedict reagent. The mixture is heated and observed for any color change. In Mr. John's case, the color change was blue-green. The test detects reducing sugar in the urine. The blue-green color indicates a low concentration of glucose in the urine. The third test is the reagent strip test, which is the urine glucose test. A small portion of Mr. John's urine sample is applied to a reagent strip. The strip changes color based on the glucose concentration in the urine. The reading was 100 mg. That provides a quantitative measure of glucose concentration in the urine, which indicates the presence of glucose. After the collection of the 3 tests, we have to evaluate the test. The first test was the glucose meter test. The result was 105 mg. A fasting blood glucose of 105 mg indicates pre-diabetes. If this is a random blood glucose test, it falls within normal limits. We also have the results for the Benedict reagent test. The results came out as blue-green color change. The blue-green color change suggests the presence of a low concentration of glucose in the urine. Normally, urine should not contain any glucose. With Mr. John's results, it indicates probably problem with glucose regulation in his body. Also, his blood was drawn to check for CK enzyme absorbance. In a minute, there was 20 absorbent. In 2 minutes, there was 70. In 3 minutes, it was 130 absorbent. In 4 minutes, it was 190. In 5 minutes, it was 250. In this page, I have the graph and the results side by side. So this is the graph and the table of the CK enzyme result of Mr. John's clinical test. Also, we carried out an LD enzyme absorbance on Mr. John. In 2 minutes, there was 330 absorbance. In 3 minutes, it was 720. In 4 minutes, it was 1,110. In 5 minutes, it was 1,500. In 6 minutes, it was 1,690. I have the graph and the table on this page to depict the LD enzyme result for Mr. John's clinical results. So we carried out a blood test that's blood glucose test, Benedict reagent test, that's urine glucose test, reagent strip test, that's urine glucose test. Also, we checked the CK enzyme absorbance and also the LD enzyme absorbance on Mr. John. In conclusion, the clinical test shows and symptoms shows that Mr. John may have diabetes, mellitus, potential kidney dysfunction, and possibly Cushing syndrome. A comprehensive treatment plan involving lifestyle modification that includes eating a well-balanced meal and also exercising. Also, medical management is important and regular follow-up is essential to address this condition and improve his overall health. Thank you so much.